Hi, my name is Eden Graves, and this is my final presentation for Survey of Exceptionalities. So how do I define inclusion, and how has that changed over the course of this semester? So throughout this course, my definition of inclusion has changed. Formerly, I would define inclusion as allowing people who may be different in on something that was not designed for their body. So inviting people to come do an activity with you or something that they normally wouldn't do. However, as I've taken this course, I've found that it goes much deeper than letting them join an activity. It is about redesigning our world not to only fit the more typical normal bodies, but we should make our world inclusive and accessible to everyone, not just people without disabilities. These people should not have to fight to have livable conditions or equal treatment. I truly believe that inclusion is a personal issue that people need to realize affects everyone, even if they don't struggle with a disability. So my definition of inclusion has definitely changed over the course of this semester. So some things I found interesting about disability and the history of disability rights. I have learned so much about the history of disability and disability rights. I found it so interesting how some disabilities are treated differently in society. For example, people who use a wheelchair are treated as if they need everything done for them. However, people with invisible disabilities are expected to live every day as if they have no issues. And as history has progressed and more disability rights have been included, I think people are coming to recognize disabilities as more than just what the eye can see. So, furthermore, one specific moment in history that stuck out to me was the Capitol Crawl protest of 1990 that truly has really resonated with me and something that has stuck with me as such an influential moment in opening up the public eyes to how serious the issue of disability rights truly is. There have been so many moments where I have thought back to this historical moment and been in awe of the bravery of the individuals and how they fought for their rights. So I've learned a lot about disability rights and history of it in general. Ableism and the barriers that people with disabilities commonly experience. So I have learned a whole lot about ableism. Before this course, I didn't really understand what ableism meant and how it affected me. I thought it was just an issue that affected people who are prejudiced against people who use wheelchairs or do other things like that. However, as I've learned, ableism is in my everyday life. It is in the way that I can open a door with ease. It's the way that I can type these words or say these words with a computer that was made without any concerns of accessibility. Ableism is not something people without disabilities can do anything about until they acknowledge how the issue presents in their everyday life. So they can't do anything until they realize that we are ableist in our society, and that is a hard truth to realize, but is something that we need to realize and accept. Ableism is not people with disabilities face disparities daily. Each day they must navigate a world that was designed without any regards to their capabilities or any sensitivity to what they can or cannot do. In everyday aspects of their lives, they deal with lack of inclusivity, thoughtfulness, and resources to allow them to function in a society that truly wasn't designed for them. Common characteristics of inclusive environments. Some characteristics of an inclusive environment are including braille and signs with words. So that is allowing people who are blind to be able to have access to clear communication. Additionally, there are so many ways to be accessible for people using wheelchairs. For example, doors that open automatically are very inclusive for all people. Furthermore, stores can be accessible by not shelving items in high, hard-to-reach places. This is beneficial for people with and without disabilities. In my future profession, I really want to find places in our area and see how to make them more inclusive. For example, I want to test out the accessibility of transportation services. A lot of people in our area need transportation, and I don't believe that we have proper transportation services that are inclusive for people who may not even be able to get down the street without assistance. So I think that whenever I am a practicing occupational therapist, I want to be able to make this more inclusive to all people and allow for them to be able to have better transportation services. In my future profession, I believe that encouragement is going to be the best way to allow for growth. So as an occupational therapist, I will be centered on growth in my patients. That's exactly what occupational therapy is. It's trying to help other people grow and develop into their best possible capabilities. Especially with children with special needs, I'll need to make sure I use positive reinforcement. So in the module that we did, I have personally seen this model work with my campers that I served at a camp for individuals with disabilities. So if I was trying to get them to brush their teeth, or if I was trying to get them to make their bed or go to the next activity, positive reinforcement and encouragement was very, very helpful. It is so important to encourage and emphasize the good the patient has done rather than just focusing on the things that can be improved on. I'll definitely be using this model in my future and other modules that I have learned about throughout this course. My personal reflection. So this course has been incredibly eye-opening for me. I have worked with individuals that have had varying disabilities. However, I've learned so much more about their needs and wants and how those differ from what society labels them as. Because I'll be in a career that is focused on change, I need to make sure that I'm not speaking for my patient and what I think they need, even if they are nonverbal or non-speaking. As I have learned throughout this course, people do not necessarily want change or need it. People with disabilities don't often want a cure, and that is totally okay. So I will need to meet each patient where they are at and make sure that I'm finding ways to acknowledge their current capabilities while allowing for their best potential. Throughout this course, I've seen many different models and ideas that I want to implement as a future practitioner. I've thoroughly enjoyed this course, and I'm so grateful to have taken it. Thank you.